Ashi point is without any part, as long as pain. For example, sometimes we found the pain not in the meridians, or not extra meridians, okay, but it's in some area. Because if you hit your arm or leg in a certain area, you couldn't find any. You never hit in a regular meridian point, any part. So this area we call Ashi point. Ashi point normally is we treat acute problems or deeper. So Ashi point we can still use this point as well. Normally to pressure this point, push, pressure, or needling manipulation used mostly. So this is why we have to talking about the location of the point. This one. And apart from that, to treat these problems, sometimes it's a very interesting thing. Sometimes, for example, in the point long meridians, long first, long one, right? Long one is to treat it location coughing point. But in the massage for acupuncture, okay, but in massage, this can treating frozen shoulder. David, come here. Okay, David, that's it.
Okay.
Okay, David, okay, can you take it off, please?
Okay.
So, yeah, this one is good.
This one's wrong.
Yeah.
Oh, okay. Go
I should give you some
Oh, you
power, so to cover.
You see
yeah.
my fat
Yeah.
tummy.
Nah, I'm more fat than you. Okay? No, normally, okay, the lung first location in the mid is location is a lateral superior to the sternum in the middle. This is red meridian in the middle. Okay, 6 cun from the middle. Okay, 6 cun, 1, 2, 6 in here, right? So that area, that's very easy. Okay, treat the coughing. If you cough, coughing. Okay, cough, make it here. Okay. So treat this one. It's okay. So, but here to treat it frozen shoulder, quite effective. Frozen shoulder normally patient put pain. Okay, patient make a pain in here. So we treat this one, right? We using plugging. Normally pressure. This is pressure. Plugging it means okay, pressure in okay and push, press and push. Let's see. This one. This one. So to treat the frozen shoulder are effective. Frozen shoulder normally ask you grasp the shoulder first, right? Grasp the shoulder first. Remember, all right? Treat the frozen shoulder. If the patient this side, frozen shoulder, you shouldn't only treat this one. Usually both sides. Okay, both sides. That's my suggestions. Yeah, in some cases they ask you both, but when you shaking, separating the frozen shoulder, you can use one side. For example, I must be using whole of the back. 最好给它来个毛巾给盖着。Yeah. Sorry.
Yes, you did.
Yeah. Today you are only the one male, so you have to be the model.
That's okay.
Yeah. Okay. So you have to using whole of the okay to treat the people frozen shoulder. Okay. Normally, first this one first. You have to release the muscle. Frozen shoulder skin muscle sticking together with you. So normally, if you're watching some video in the Google or some YouTube, how to treat frozen shoulder massage, okay, grasp this one first. But my suggestion, you shouldn't grasp it. You have to, right, grasp both of them. But when you shake, separating you, for example, this side, you have to use this one, okay, to do this one, right? This one. But at first, you must release all of the muscles, right? Remember, massage sometimes is local, but you treat it for whole of body. This for frozen shoulder, right? So for example, you can use this one, okay, and then shake this one, right? To plug we call the bar, shen, this one. So this side we need to do that one. For example, here we can using this, okay? We can release it. This one. For another side, we don't need to do that one. But when massage, at first we have to massage whole lot. So this is what we can do. Right? So today we're talking about location. Location point, first is if we have to, according to meridians arrangement, regular, okay, flow regular meridian from the lung, large intestine, right? And gradual little by little. Let me talking about. We using massage point quite limited, but it's better we have to learn more than that one. Yeah, in clinical, in my opinion, using about 20, 50, that's enough. But in here, perhaps that's enough. But we have to know more than that one. First, we have to know today. Let me back to the first point. We got lung meridians. Okay, in here, in the medium, right? 6 cun about that one. So just like here. Okay, this bone inside we call the countercostal point and countercostal. Here, so that location is here. Very easy to find. Sometimes you can pressure here. You can make it feel pain, feel very, very painful. That is, right? So that's the lung meridian, lung one. To treat it one, to treat the coughing or from the shoulder, that's quite effective. Using plugging. Plugging is mean using your hand, pressure and pushing, right? Pressure, that's a keep still, okay? Pushing, the local. Pressure and pushing, you have to do a large term. It's okay?
Yeah, it's okay.
It's pain?
Yeah.
Yeah, it's painful, I know.
Yeah,
Okay,
okay.
so this one. So apart from that, so this is lung meridian. We can use this. We can use this, okay, 1 point. First, you can write down, okay, with lung one. So plugging is necessary. Okay?
Okay.
How about asthmatic cough?
Asthmatic cough. Normally, if people asthmatic cough, normally it depends. It depends how long, right? If acute, it's better for you to using your palm, rubbing, okay, rubbing. Yeah, this one. But it's better for you if the getting cold. You are still using gallbladder 20 first. Gallbladder 20 quite effective to expel external wind and internal wind as well. So brushing this, okay? This is a method. So pressure, okay, this one first, and release the muscle on the neck, right? Then release the muscle on the shoulder, right? And then rubbing on the back. It hurt?
No, no, that's good.
Yeah. And then later rubbing, okay, on the chest. This one. For the baby, for the adult. For the baby, you are using infantile massage, right? Using arm, right, on the arms, right? But for the adult, just like rubbing on the chest. You rubbing, you remember, mild, slowly, until the people feel your heat on the hand benefit into your chest, make it warm. Just release the muscle. But asthma make the muscles spasms, okay? If you're massaging that one, right? That make the muscle, right, relax. That is what we can do for that, okay? Remember, always make the muscle relax. That's quite important thing. So be very careful, right? This one. But if my suggestion, okay, this one. If you are male, for the females, it's better don't do that one on the chest. If you do that one, you must be never touch the breast, okay, only in that area.
Yeah.
The palm, okay, using palm, rubbing that one. It's better for you under another relative to see you are not, okay, do some, okay? So you must be very careful. This
Let them
method
do
is-
themselves.
Yeah, let them do themselves is okay. If people very weak, okay, they couldn't do themselves, I suggest you using your palm on the back as well. On the back, how are you feeling? If I'm rubbing on the back, how
Very, very good.
No, I don't. I
Oh,
asked you how are you feeling. You are very good. Of course, very good. You always sit in the office. You want to release your muscle. I just wonder how are you feeling? Do you feel something heat inside?
Yes,
or
I do.
something?
Yeah.
Yeah, that's one.
Yeah.
Okay, that's one thing. Okay, David.
Okay.
It's a
Okay,
little
thank you.
cold as well.
Yeah.
Yeah.
Yeah. Good call.
Right. Okay.
Thank you.
Thank you.
Okay. No, sit down.
Oh, sit down. Okay. I'm not going anywhere. Good.
Yeah, this one. So this is the one. And another point is the lung meridians as well. This we call the lung 5. Lung 5. Okay? Lung 5 location. Lung 5 location. Okay? On the cubital creases here. Right? Cubital creases, okay? On the radial side, this is radial. This is ulnar, right? This is radial. Why is it called radial? Because one of the nerves, radial nerves from here. Sometimes the people has a spondylitis. We turn, for example, just like David. For example, David, he just turned his neck. Oh, suddenly he chew one of electricity. Okay, trap to the thumb or trap the finger. Why? Or trap to the why feel numbness? Because radial nerves or ulnar nerve has been trapped on the neck. That's caused problem. This is why this we call radial nerve side.
Right.
This is cubital. Okay. So so this is one, right? So cubital creases. This one here. Okay. Here have C. This creases here. So on radial side, right? On biceps bronchi, just like tendon. Okay. Biceps. Okay. Here. So this point is the location in the elbow. Slightly fixed. Okay. Right. That's inside. So this is area. This point is in the special point we call the he. What is he? In the Chinese acupuncture, totally acupoint, in China there is 331 regular point. This 331 point, remember, can you using all of them? Of course not. But all of the points, just like a herbal low top, can you use all of them? No. You can use some special. Mostly treat the diseases with using special point. Special point, later I'm going to talk about. Special point, in this point we call the he point. He is mean, he point. Any organ has any organ's direction. What does it mean? For example, David, what the qi of the lung going? Going down or go up? Go up, go down. Qi, lung.
Probably go down.
That's right. That's right. What about the stomach qi? Okay, what the stomach qi going to? Go down, go up.
Up.
Stomach qi,
Down.
go down. Yeah,
Down.
you're right. Go down.
Up.
Yeah, go down. Why? Because if the lung of the qi go up, breathing in, okay, the qi should be go down through the body, right? It's the lung, the qi of the lung. But if qi of the lung go up, that's called coughing or asthma,
Yeah.
right? Meanwhile, stomach qi is the same. Stomach qi when eating food, where food go down, go up? Should be go down.
Yeah.
You couldn't eating the food and then vomiting food again, right? So you have the qi, stomach qi go down. So but sometimes if the diseases, the function of the qi will be go upright, go up. So this is we need the he point, special point. The he point in here, in the stomach, the he point is stomach 36. That makes the qi go down. So this is why sometimes the asthma, right? So this is he. He is mean special point. Special point is mean is he in here is mean harmony. Harmony. This harmony is make the qi go harmony. For example, if the lung or stomach qi go up, function in the weak. So go down, nicely make the harmony. You must regulate. Oh, you go up, no, very good. Okay, we must go down. So this he means balance. So this is why in here, pressure, coughing, okay, pressure, that's okay. Normal 啊，
曲折吧，是不是曲折？
尺泽，
尺泽呀。
尺泽，曲泽是那个，曲泽是那个。
哦，现在讲的是肺经嘛。
对，我讲的是肺经，我先讲的。So this is necessary. Okay, so that point is quite important. So that the her point it means go down. To treat the long coughing or asthma, effective is very good. And meanwhile, this area, let me see, that area sometimes, okay, to treat the tennis elbow as well. Tennis elbow normally in large intensity, but in here, sometimes, okay, if you pressing here, to treat the tennis elbow, release the muscle tension as well. Right? Remember, tennis elbow, where's happen? In outside. Okay? In outside. What about inside pain? What's that? Inside pain we call the golf elbow. Outside pain we call tennis elbow. Tennis elbow just like David. If the David play computer very long time, okay, in the mouth, you can see, if he in the mouth, he always do that one. That posture, you can see, he sit down, okay, only do that one. Right? But sometimes in the long term, moving, especially some people call him suddenly twisting. It doesn't matter, oh, he has tension. But and then tennis elbow will happen. So this is why, okay, people have tennis elbow, be very careful. As long as you do something, oh, you feel stiff, you should be change the posture. Oh, you should be relaxed, make it mother relax. Because you even the desk support your hand, you stood, okay, you couldn't, okay, make you relax. You can still feel tension. So to do this one, push, okay, or kneading, rubbing, right, mild, that's necessary. Remember, I still stress again, any point pressure or kneading, you have to mild, slowly first, right? Never very hard, or if very hard, okay, make more pain. So mild, release the muscle. Generally speaking, massage, no matter what the problem, massage the function is making the muscle relax. The muscle relax, you have no any problem. Only muscle cramp or muscle begin diseases, right? So that's kind of waste, okay, actual waste. So that is you can use your massage to do that. Normally release the muscle, make the muscle become the normal. Resting, that's necessary, right? So this is okay. This is the second point we call 指责 location, and another we have to learn acupuncture. Okay, the Chinese anatomy knowledge is different from conventional. So from here until the wrist crisis, how many points in here? How many twin? Do you know the length of this one? The length from the wrist crease until the cubicle crease, this is 12. 12. Right, remember that is 12. Right? So that is 12. That's meridians, right? The 12. So in the half of them we call 6 twin, right? 12 twin, 6 twin, right? So meridians, long meridians belong to yin meridians. Why belong to yin? Inner, inside. Okay? The yang meridians in the outside. On the hand, there are three kind of yin meridians. One is the lung, one is the pericardium, and another third one, it is the heart. Okay? You have learned that one before, right? So that's one. So in these three meridians, the common character is they only from inside, from chest, right? From chest, and then through the arm inside, right? And then ended on the hand. And ended on the hand, connecting with the 300 yang meridians, right? According to the traditional Chinese medical theory, they have internal, external organs outside. The yang meridians, which is internal and external organ for the lung, is the large intestine. So this is why the large intestine from yang, right? From the yang, from outside, from arm, from the hand, and go through the arm, go back to the head. This one, this character, okay? And from the head, connecting, yang connect with yin, okay? This is connecting with another yang meridian, right? 3-foot yang meridian. These 3-foot yang meridians we call the longest meridian. Okay, from the foot and go to from head, right, and go through the tummy, through the then outside in the end on the foot. So this one, and the foot connecting with 3 foot in meridians. These 3 foot meridians from the foot then go through the leg or thigh and side, they through in the tummy inside. So this is we call combined circulation. So these 3 in meridians, okay, at first, okay, from the hand in, okay, hand in and then connect with hand yang. So hand in meridians, right, from inside here. First meridian, lung, pericardium, and heart. So in this one of the point from here, from a wrist, and so cubic 12, on half of them is 6 inch. If you see the in meridians, long meridians, okay, from the arm go through, that's ended in here, okay, in the thumb, in here thumb. So another point, why I ask you, why we are talking about another point is 7 寸 above the wrist, okay, of the wrist. This we call acute point, 孔椎. 7 point. This 7 point very simple. You first you can use it 尺泽 point. Have you seen there's tendon inside? Okay, 尺泽 in here found. Okay, the lung 5. From lung 5 found connection. Okay, connection to the wrist. This one, right? The pulse, right? You can feel the pulse from here, and then you can see along the line here about this one 6 寸. 6 寸 you can see for half. 3 寸, 3.5. So here, right? Here is point we call 孔椎. Yeah, this is to treat it acute disease. If you hear pain, if people feel coughing, asthma, acute, okay, pressing here first. Both sides, pressing here, yeah, pressing here. Found location here, yeah, pressing, right? Just like a key, if people coughing, okay, you acute, okay, just a pressure, okay, and up pressure, okay, pushing and pressure, that one pushing. So this is to treat the acute disease very effective. Coughing, asthma, anything, because they belong to lung. So this is the lung meridians. Another part we can see, we feel the pulse is still belong to lung meridians as well, right? That's necessary. So this one, so to treat this one, okay, pressure, location, okay, location this one is necessary. Sometimes in my hospital, you will find many doctors just using acupressure. Okay, they don't use just the pressure here, okay, and then up pressure, okay, along to this point to treat the lung disease as well. Okay, just like okay, the Jian, okay, Jian Guo told asked me asthma. Sometimes my teacher to treat the asthma or coughing, just like I found what's wrong. For example, excessive, right? People came for a long time, they knew which is deficiency or excessive. If excessive, okay, if the people, for example, if David coughing, what's wrong with coughing? Getting cold, right? Sometimes if David allergic, hay fever or something, asthma, it's very simple. We can use it, okay? My teacher, just like follow the point, okay, against the meridians. Against the meridians follow. For example, okay, if it's coughing, okay, for how long? Oh, just okay, very simple. Heat or cold, it depends. Right? And then pressure the point. Right? And then gradually against follow, right? Just like follow the meridians, right? Or against the meridian. Follow meridian, just like okay, to treat the meridians, right? Just like to enforce.
Yeah.
But if you excessive, we just like against.
Oh.
Okay,
Right.
against.
Oh, so if you want to add, then you follow. If it's got too much,
Yeah.
you against.
Excessive,
Right.
against
Against.
your meridian
Right. I
treatment.
see. Okay.
Right? Against is mean excessive.
Right.
Right? Normally your meridian came from here.
Yeah.
But if you excessive, something wrong, okay, we must against it.
Oh,
Right?
okay.
This okay, this one. to treat, so this point, right, the 7th point to treat acute, okay, this is a 控制, okay, lung 6, okay, we call 吸 deeper, acute, so treat, okay, if the cough is okay, to do this, that's enough, oh, and this 3 pounds, that's enough, to treat coughing.
So if you suffer from hay fever,
Yeah,
you
if
also,
from a hay
you
fever,
also go against.
that's true.
Yeah.
It depends. For example, if some people long time hay fever,
Yeah.
the lung, the qi of the lung very weak, deficiency. So this is why we have to again, okay, follow that, right? We have to follow from here, to follow, right? To follow this treatment, right? This is we call it reinforce.
Right.
If you exercise, okay,
Right.
or if too much, for
Yeah.
example, acute, right?
Yeah.
To treat this one first, right, and then gradually. So this is for the lung. So for the lung, lung diseases normally is coughing or asthma, right? And one of the things we remember, lung is the upper source of the water. The lung, remember, lung has another character. Lung, when you breathe in, making the water, I mean body liquid, storage in the stomach, and the spleen through the lung, and the lung spleen go into the whole of the body. Have you noticed some people said, I wake up in the morning, I found swollen in my, swollen on my eyes, on the face. Yeah, some people, oh, it must be kidney or spleen. No, even the water you found, eyelids, found, swollen, it's a lung. It's a lung problem. And meanwhile, if the lung couldn't making the water through the lung go into the bladder, sometimes they make it swollen on the ankle as well. One thing I want to remember, if you found the people swollen in the ankle, I suggest you forbidden using massage. Why? You can use in lung. Yes, you can. Yes, you can. Normally, it's okay for the arm, but if the ankle, that must be the leg. Sometimes it's a serious problem. So herbal is better than massage. And meanwhile, acupuncture, put needle in, is more effective than massage. Why? Because a massage is very difficult for you to using your how to do that one. If the swollen, is with the edema on swollen. If you push too much more strong massage, making swollen get more worse because the tissue has been changed. So acupuncture more easy than that one. This is my suggestions. So remember.